In the U.S., April is Sexual Assault Awareness Month. So to promote advocacy and awareness and counselor competency in the area of healing sexual trauma, this month we'll be focusing on the sexual trauma client at the Beginning Counselor blog. Today we're going to be talking about your sexual trauma client, the reality of their experience. Do you really know what it's like to be a survivor of sexual assault and abuse? Most of us have no idea what our clients that have been through sexual trauma really endure, who their perpetrators are, what it's like for them when the truth comes out, and what they face afterwards. Most grad schools will not give people the option to take a class in the effects of sexual violence, and yet it's essential as therapists that we learn how to handle this scenario. As it says here, 1 in 6 women have survived an attempted or completed rape. And sexual assault against men is still a reality that is very much kept in the dark. A sexual assault or abuse may never be physically violent. It can happen in a same-sex relationship. It can happen in a marriage. It can happen to the elderly or someone physically handicapped. A sexual assault occurs every 2 minutes. Out of every sexual assault or abuse, there will be justice is the great myth that we always hear. In reality, most of people don't report. And when you think about it, you have to wonder, why would they? As you recall, 2 out of every 3 cases of assault or abuse are by someone the survivor knows. Their mother's boyfriend, their stepfather, their half-brother, their cousin, their neighbor, or their family friend. To expose what happened to them, they face spoiling the image of their perpetrator in the minds of other people they love and care about. Worse, they risk the person's disbelief. Other people who might provide support to them may choose the side of the perpetrator rather than that of the survivor. Without exception, the cases in which I spoke with survivors who told someone they love, usually a mother, about the abuse, and the mother refused to believe them or pushed it away, the survivor said that her betrayal was far worse than the abuse in the first place. There's a very real fear that those who tell will be perceived differently by those around them. They may think, will I still be able to go to the mall with my friends, to be seen in school, to be respected in my workplace if this gets out? And while I have the utmost respect for police officers, and I have several family members in the force, I have to say that as a profession, they don't always do the best job with survivors of sexual assault. There is an element of skepticism that seems to be hard to stamp out. The idea that most who report sexual assaults or abuse are lying. The reality is they just aren't. A police interview is a very intense thing, an awkward thing. You're brought into the station and have to report in excruciating and embarrassing detail what exactly transpired. You have to say who put what where and when. You have to be questioned about why you were there, what you thought was going to happen. Were you drinking? Were you doing drugs? Did you have sex with him or her before? It's incredibly uncomfortable, and many people who have absolutely been through sexual violence themselves still refuse to participate in it, even though it leaves the perpetrator unpunished. It's that awful. Those few people who do make up abuse or assault are quickly discouraged and find it really isn't worth the effort. Police training as a whole runs counter to sympathizing with a case of sexual assault. A normal post-traumatic reaction is to do things like forget details, mix up the order of events, and even appear to change your story when correcting aspects of it later on. To a typical police interviewer, this very naturally appears like a suspect who is lying. And Violence Against Women International has been a significant factor in correcting this problem, as they offer educational webinars retraining police officers on how to effectively interview sexual assault survivors. Rape exams can retrieve evidence up to 96 hours after an assault has taken place. It's important that survivors and hospital staff are aware of this, because since a rape exam is difficult and time-consuming to perform, some will waive off the request to do one or say that the police have to request a rape exam in order to perform it. That's not true. Any survivor has the right to request a rape exam in order if the assault occurred within the 96-hour time period where evidence is still viable. That's why trained survivor advocates are often despised by hospital staff, because it's their job to assert these rights when the survivors don't know to ask for it themselves. Survivor advocates must at all times balance the task of supporting the survivor without alienating the hospital staff or police officers present, because the survivor is not often in a state where they can offer this kind of balance. Laws regarding sexual assault have changed in the past few decades, so extremely old school or experienced doctors may not know of this rule or simply not see the significance of it. My husband is a medical student, and I know how much pressure they're under, especially in the ER, and especially in cases where someone's bleeding or having a heart attack. So I don't want to denigrate them in any way. An assault survivor in a crisis situation still can't seem like the highest priority when you're faced with someone who might die if you don't put pressure on their wound. I can't say that I would be able to see the situation differently if I was there. But survivors need the respect and quality care too, which is why I believe so strongly in hiring trained, sane nurses, sexual assault nurse examiners, who know how to do rape exams quickly and respectfully. They're trained in how to be thoughtful of emotions while at the same time collecting all needed physical evidence. In addition to the pressure on medical staff in ERs, pressure that can't possibly be good for the staff or the survivors, rape exams are often just not the solution most people think they are, maybe just due to a lack of physical evidence. The attacker may use protection or find another way to obscure the assault. This is the reality that most survivors face when they report an assault. The story has slightly better results, thankfully, for children who report, as they're more often taken to a child advocacy center with specially trained nurses and believed in their stories. When you report a sexual assault or past sexual abuse, here's what happens. You have to retell your story, and to prepare for the trial, if it goes to trial, you must be prepared to explain every action you took that could possibly make what happened your fault instead of his fault. If the assailant gets convicted, and that's a big if, their jail time will be minimal, except for under extraordinary circumstances. The opposing lawyer and your counsel both feel like they're against you much of the time, and sometimes the judge even lets you down. The further reality is that you're often automatically disbelieved if your perpetrator has a great deal of power, or maybe your story never reaches the light of day. Or you may feel like you have to cover it up yourself because you will be seen as soiled by your religious community or as unworthy goods in your culture. While this perception is more common in third world countries than in America, you still may run into this in the US from time to time. If you don't know how hard it is to report, you don't know what your client went through to report or why he or she did not report. I made the mistake early in my career of not giving past sexual abuse or assault the attention it deserved. It literally affects most of your life and definitely can be overcome, but not if it's not dealt with. It's that important. Next week, I will return with Words That Oppress and Words That Heal, the power of language and sexual trauma therapy.